Let's talk mental health. Just to recap our last feature, there is no single cause for developing a mental illness, but certain factors can increase its risk. Let's take a deeper look at some of these factors. One of the biological factors that increases the risk of developing anxiety and depressive disorders is the imbalance of chemicals in our brains. Chemicals such as dopamine, serotonin, and norepinephrine help to regulate our mood. Hence, imbalances in these chemicals can alter mood and increase our risk. We can also experience a change in our mood as a result of hormonal changes associated with puberty, pregnancy, and menopause, or if we have a diet that is deficient in certain vitamins and other nutrients. Let's now move on to psychological factors. Some personality types are at greater risk for developing mental health disorders. Personalities that tend to dwell on or ruminate on issues, work towards a state of perfection, or are overly self-critical can find it difficult to manage and cope with stressful situations. In addition, our attitude, belief of ourselves, and how we perceive the world can also affect our mental health. For example, a negative self-image or a negative perception of people or the world could harbor feelings of inadequacy and hopelessness, which could contribute to an increased risk of depressive and anxiety disorders. Adverse childhood experiences. Unresolved issues from our childhood can affect our mental health as adults. Some of these traumatic events of physical, emotional, and sexual abuse can increase the risk of developing mental health disorders such as anxiety, depression, and post-traumatic stress syndrome, PTSD. Other adverse childhood experiences that could increase our risk are 1. Feelings of abandonment or neglect by parents, caregivers, or family members, and 2. Family dysfunction, such as experiencing the divorce of our parents, experiencing the preferential treatment of siblings, or even experiencing or witnessing abuse in the family. In Feature 6, we will continue to look at 4 other factors that could increase our risk of developing a mental health disorder.